61% of college students have reported feeling tremendous anxiety. This was a recent statistic that was used in a Time magazine article talking about the rising rates of anxiety in college students. As we've seen these rates continue to increase, so has the demand placed on university counseling centers. I am a student who personally struggles with anxiety, and I decided to focus my research on what universities are doing to try and combat these rising anxiety rates. We've seen that as more and more students seek help in university campus counseling centers, universities are increasing their funding and trying different ways to reach these students before they come into those counseling centers. In my presentation, I will first look at what anxiety is and what we're currently seeing in college students. Then we will discuss how universities have increased staff funding in their college campus counseling centers. And finally, we'll look at some of the different ways universities are trying to reach students before they come into those counseling centers. So first, let's look at what anxiety is. Anxiety is a broad term that we use to describe that feeling of nervousness or worry. Think about how you felt while preparing for the speech. Even though you've prepared and researched, you may have felt a little bit anxious about how it will go or about your topic. Anxiety is a normal reaction to stress. When we're talking about anxiety, it's important to note that there's a difference between anxiety and anxiety disorders. Anxiety disorders are classified by the American Psychiatric Association as excess fear or anxiety. There are many different types of anxiety disorders, but the most common ones are generalized anxiety disorders, social anxiety disorders, and phobia-specific disorders. So anxiety is that feeling of nervousness and worry, while anxiety disorder is an excess fear or anxiety. Now let's look at how anxiety is affecting college students. In a 2016 study by Penn State University, anxiety surpassed depression as the leading mental health issue facing college students. You can see in this chart from that study that 61% of students cited anxiety as one of their concerns. Before 2016, depression was the main concern that college students were citing. But as of 2016, it is now anxiety. As we've seen anxiety rates increase, so has the number of students who are seeking help in college campus counseling centers. If you look at this chart from that same study, you can see that in 2011, about 82,000 students sought help in counseling centers across the nation. In 2016, that number jumped to 150,000 students. Just for reference, enrollment has steadily increased by about 5% among college students. We are actually seeing a larger jump than would be expected with that enrollment increase. And it's no surprise that these numbers are causing colleges to look at how they react to mental health. One of the main things universities are doing is hiring new staff and increasing funding in those college campus counseling centers. According to a 2016 study by the Association of University and College Counseling Center Directors, or the AUCCCD, 41% of college counseling directors reported adding more staff. University of Iowa, for example, increased their counseling staff by 50%. Ohio State University added about a dozen mental health clinicians. If you look at the chart from that study, you can see that most of the people added have been in the clinician role. This has allowed universities to maintain a ratio of about one therapist to every 1,737 students. While this is still above the recommended ratio by the International Association of Counseling Services, this increased staff members have allowed universities to focus on rapid response services like walk-in appointments. And as a result, counseling services centers are able to treat more patients. Counseling centers are also increasing funding. So Penn State, for example, allocated about $700,000 in additional funding for counseling and psychological services. According to that same AUCCCD study, most universities reported increasing their counseling salary budgets by about 55%. That increase in funding has not only allowed centers to hire more counseling staff, but it's also given university centers the ability to offer more helpful services other than counseling. For example, some universities offer anxiety management workshops that any student can attend. The large counseling centers and increased funding have allowed universities the ability to reach more students in need, but universities are also starting to come up with ways to reach students who are struggling with anxiety, who have not yet stepped foot into those college campus counseling centers. One of the ways they're doing this is by being proactive. UCLA, for example, now offers a free online screening tool for anxiety to all incoming students. This allows the center to reach out to those students who are exhibiting severe anxiety symptoms. Virginia Tech University, on the other hand, is now opening up satellite counseling centers near areas where students spend most of their time, such as Starbucks, the athletic department, and the student center. Other universities are looking at online resources. Ohio State recently launched an app that allows students to make counseling appointments on their phone, to access meditation and breathing exercises, and to listen to upbeat playlists. University of Virginia, on the other hand, developed Silver Cloud, which is their online mental health tool. This tool allows students with anxiety to access cognitive behavior therapy programs online. Students are able to view learning modules, anxiety management exercises, and other resources. These creative programs have allowed students to access counseling service without ever having stepped foot into the counseling center. As universities continue to increase funding for mental health services, they will also continue to come up with more ways to reach students who are struggling with anxiety. So to recap, we saw that anxiety rates are rising, and anxiety is now the main mental health concern among college campus students. As a result of this, universities have started to increase funding in their college campus counseling centers. Most universities have increased their counseling salary budget by about 55%. And finally, universities are looking at online resources and other tools to reach students before they even step foot into those counseling centers. Hopefully, with all this new funding and resources, we will start to see that 61% college students with anxiety decrease. And when we look at anxiety in the upcoming years, hopefully it will not be the major mental health concern. Thank you.